Hi, everybody. Good evening and welcome to BioMonde Live. Thank you very much for joining us. This evening's webinar is all about how we produce larval therapy. So it's a little bit of something new for you. You might not have seen this before. And this is the first in our new series of webinars for you. So we will be presenting a different topic every month, which is exciting. So I'll hand you over to Vicky and I hope you all enjoy. Thank you.
Thank you very much. But let's have a look at what we're going to be talking about today. As Rebecca said, these are all different topics. Today we're going to be looking at the behind the scenes, how we make the larvae and produce the biobags. It's something we get asked about a lot, so hopefully you'll find it interesting. The key thing to note that we're not going to be talking about sort of clinical application or anything like that. So if you want to learn about that, then I'll show you at the end how you do that. But today we're going to be looking at, how we do our aseptic production process. We'll learn a little bit more about the fly species and how it works, and we'll look at getting you all that information that you need so that when you're talking to your patients you can give them as much reassurance as possible about the larvae and the product, and help them feel as comfortable as possible about having the therapy. So first of all, we're going to have a look at the fly that we get our larvae from. We use the fly Lucilia sericata, Latin name. The common name is the common green bottle fly. And I'm sure you've all seen them before. They are always flying around, especially in the summer, aren't they? And there's a few reasons we use this fly. So firstly, they are indigenous to Europe. That's, from our point of view, very helpful because we don't have to create an artificial environment for them necessarily, and certainly when you're using the larvae you don't have to worry about conditions too much as well. We also particularly like this larvae because they're very safe to use on humans, and that's because they will only debride dead devitalized tissue. They won't do anything to healthy tissue. They can't dig or tunnel or burrow or do anything like that into the healthy tissue. So once all that dead stuff is gone, they stop working. They have a predictable life cycle, which I will show you in a minute, which means from a production point of view, we can sort of manage the process very nicely. And certainly when you're using the larvae on wounds, you don't have to worry about knowing the different stages of larval growth. You can just follow the care plan and you'll be absolutely fine. And most importantly, and sort of the topic obviously that we're going to be talking about today, is the larvae are robust enough to survive disinfection. Now obviously we're creating something for use in a medical setting. That means we have to stick to very strict guidelines, and so it's important that the larvae can be disinfected to a level that is safe and adheres to those guidelines. So let's have a little look at the life cycle, and obviously we need to know about this a lot at BioMonde so that we can make sure that we are producing happy, healthy larvae for use in wound care. So I generally start with the male and the female fly. They will mate and then they will lay their eggs, and you can see there the female fly lays a lot of eggs across their lifespan. So around 100 to 150 eggs a go, and about 15 times she'll do that. So gosh, that's a lot of eggs, isn't it, per fly? And all of these eggs will stick together in clumps, as you can see in that second picture. The eggs will take about 12 to 24 hours to hatch, and then when they hatch, the little larvae are about 2 to 4 millimeters in length, and they will start feeding as soon as they're put on their food source. So basically, as soon as we put them on the wound, the little larvae will start feeding, and they will feed for about 3 to 4 days, 96 hours we usually say. And then during that 96 hours, they will grow from that 2 to 4 millimeters to about 10 to 12 millimeters. And then they've reached their full capacity, and even if there was still food source available, they would stop and they would want to go and find somewhere dry. Their skin would harden and become their pupae shells, which you can see in the little number 4 there, and then they would take about 7 to 10 days to pupate and emerge as flies. Now, obviously, when you're using them in wound care, you don't really get to see the most of the stages. You'll just see them as maggots. So it's important for us to understand about those different stages so that we can get nice, healthy maggots out to you. And that takes me quite nicely onto our next little section, which is all about fly husbandry. And I bet that's a term you never thought you'd hear. In the UK, we produce all of our larvae that are used in the UK in our facility in South Wales in Bridgend. We also have our sister site in Germany, where we supply about 10, 11 countries across Europe. And they work very, very similarly, not exactly the same, but very, very similarly. And there'll be about, certainly in the Bridgend site, there's about half a dozen rooms, and they're all getting graded at a certain level of sterile, and they get more and more sterile as you go through the process. And we're constantly making sure that we're adhering to those really strict guidelines that I talked about, to make sure that we're not sending anything else out with the larvae. The second picture you can see here, this is our colony of flies. So we have a closed colony. And what I mean by that is we're not introducing any wild flies, because they could bring their own sort of infections and microbes and other things like that. It also ensures that we don't get any sort of abnormalities when it comes to breeding, or it helps us reduce them anyway. And we have a 5-week cycle of flies in our closed colony, so that we're ensuring we're constantly getting eggs being laid by the females. And a part of those eggs that we produce, that the larvae produce, I'll say that again. Part of the eggs that the fly produce will be kept back and allowed to mature into flies, and obviously the other half are let out to be used in wound care when they hatch into little larvae. So it's a self-sustaining colony. Conditions in that fly room are kept to a very optimum temperature. So the flies basically think it's summertime all year round. They have the same number of hours of daylight and night light all year round, because then we know we're getting the optimum sort of conditions for them. We make sure the temperature is controlled for them, and we're obviously making sure that we feed and water the flies with a really optimal diet as well. So they're really, really very well looked after. In fact, our flies in the colony live a lot longer than they would out in the wild. So if you could spoil a fly, then they definitely do get spoiled. And because of all of this, we're having to go in every single day. So even on Christmas Day, we have got people going in to make sure that they are feeding and giving the flies plenty of water, so that, it's just like any other animal. They need to be looked after every single day. So in those little boxes, we will put a sort of synthetic protein that stimulates the female flies to lay their eggs. And then we will harvest those eggs, and we'll go through a very stringent disinfection process with them, as I keep sort of saying. And you can see here, as we're going through that process, which I'll talk about a little bit more in a minute, the production staff are wearing a lot of sort of get up, if you like, to make sure that they are sticking to their end of the bargain of making sure that we are keeping that process as clean as possible. And there's all sorts of other things they do as well. So like they're continually using alcohol wipes, gels, sprays to make sure that their hands, although they're gloved, are clean. They'll be wearing these sterile suits that you can see during the disinfection process. They very much limit how much time they are interacting with the eggs and the larvae, so they're not touching them any more than they need to. We'll talk about how we do the physical disinfection in a minute, but whilst they're doing that, they're touching equipment as little as they need to. We also have filters in the rooms, which will positively push the air out and make sure we've got clean air constantly in the rooms. And they're all very well trained at aseptic techniques, so they're aseptically placing the larvae into the biobags, so they're never touching anything that they don't need to. And in fact, our production staff in Wales, they have been with us for a very, very long time, some of them as long as 20 years. So they are very, very experienced at keeping these very high standards, and people have to be working with us for at least 2 years before they're even allowed into that room, and I'm certainly never going to be allowed in that room. So yeah, it's very, very strict processes and policies that we stick to. So as I said, The flies lay their eggs, and then we collect those eggs, and you can see they're in these clumps, and we need to separate them into their individual eggs because we need to make sure that we disinfect all the surfaces of the eggs. When the flies lay the eggs, they'll actually pass on some of their gut bacteria onto the eggs, because in the wild they want them to have a little bit of resistance and a bit of protection, but we want to get rid of that. So we'll put the we'll put the eggs through like a week disinfection. It's all sorts of different things in there, like an acid type solution, which separates the eggs. They go through like a centrifuge with that solution. It separates the eggs and it disinfects all the surfaces. So you can see here, this is the like the start of the process. I've got a good video in a minute where we go through it in a bit more detail, but that will get rid of any bacteria, fungi, viruses that are on that surface. Once the little eggs have been disinfected and separated, they are then placed onto sterile agar plates, as you can see here, and that's where they're incubated and they're allowed to hatch. And this takes about, as I said, 12 to 24 hours. We can control it a little bit with temperature, so the warmer it is, the faster they'll hatch. So if we need to sort of speed up the process or slow it down, depending on how many orders we think we're going to get in over the next few days, then we can control that a little bit. And then you can see in this picture here how when they hatch, the little larvae are all clumped together on that agar, and that agar has a little bit of nutrition, a little bit of moisture in them, just to keep them going until they get out onto the wounds to do their proper work. And then once they've hatched and we're ready to get them all packaged up, ready to come out and do their job, we will then put the larvae through that disinfection solution again. So they do need to be doubly cleaned, once as eggs, once as little baby larvae, to make sure that they hit those targets and be as clean as they possibly can before they go onto wounds. And then finally, once they've all been cleaned, they then get put into these little bio bags, which I'm sure you all know, and we'll talk about them a little bit more in a minute. The number of larvae in a bio bag is measured depending on the size of it. So a BB400 will have 400 maggots in it, roughly, at least anyway, and a BB50 will have at least 50 maggots in it. So we're always making sure we check that. And during the packaging, the team will make sure that there's no sort of compromise to the bag. They'll be looking out for splits, holes, anything that could mean that that bag is not up to scratch. They'll be inspecting that, and obviously if they find anything, they will take that out of the system and they'll make up a fresh one. And as I say, they're constantly making sure they're not touching anything. You can see they're using forceps here to hold the bag, so they're not actually physically touching anything that they don't need to. It's a very sort of it's a skill to make sure that you can do that, because I don't know if you've used those tongs much, but they can be a bit fiddly, so they're very well practiced at doing this. And then there you have it. You can see the bio bag all sealed up. It's all ready to go. That will then go into its yellow test tube, yellow top test tube, and then into the packaging. And again, this is all done in a clean environment to make sure that we're not introducing anything at any stage of the process. Okay, so I have got a video to show you on that. I'm just going to check if I've just gonna press play. If you can't hear it, if someone could tell me in the comments, that'd be great.
Needed to produce medicinal quality larvae. The fly species used is the common green bottle fly, Lucilius ericata. The number of fly cages depends on the numbers of flies needed to lay the required quantity of eggs, which develop into the larvae used for the product. The fly cages are covered with labius tights to stop the flies from escaping and to allow the easy transfer of materials into and out of the cages via the cut-tight legs. The flies prefer a moist, dark and quiet place to lay their eggs, so the egg collection devices consist of a dark plastic container prepared with a special medium whose odour attracts the female flies to lay their eggs. Small plastic strainers are placed into the medium inside the container to facilitate the egg collection. The containers are placed into the fly cages and left for a few hours for egg laying to take place. After this time, the containers are removed and the eggs collected, weighed, and used in the production process. The collected eggs are used for two purposes. The largest number are used to produce the medicinal quality larvae, which is the active ingredient for the larval therapy products. A small amount of the collected eggs are used for stock breeding. These eggs are placed on a special medium in plastic boxes used to rear the larvae. After collection, the eggs are processed to produce the active ingredient of the medicinal product. The fly eggs are washed and separated in a controlled environment. A small fine mesh sieve is used to aid in separation of the eggs to ensure that individual eggs are available that have their whole surface accessible for the disinfectants. After the initial disinfection, the eggs are transferred into the clean room. The next steps are performed in a Class A clean room cabinet. The first disinfectant solution is washed off the eggs before they are transferred into a second disinfectant solution. After the final washing step, the eggs are resuspended in a sterile saline solution and transferred onto specially prepared agar plates using a sterile pipette. A sterility test of the disinfected fly eggs is performed for each sample prepared. The fly eggs hatch on the agar plates and develop into larvae in the required growth stage. Before use, each subplot is tested again to confirm the sterility of the larvae. Only sterile subplots are released as the active ingredient for production of the final product. The filling and dosing of the final medicinal product is also performed in a Class A cleanroom cabinet. The entire process is closely monitored for microbiological and particle contamination to ensure a clean environment throughout this critical production step. The final products are transferred into sterile plastic tubes, the primary container, and labeled with the batch, expiry, and product information. All raw materials used for the production of the medicinal product are sterile and approved for use by the quality department. The final products are transferred from the clean room into the dispatch area, where the tubes are sealed, labeled, and packed into transport boxes, ready for dispatch to customers.
Oh, I don't know about you, but I love the vintage music on that video. So moving on to, as I said, we talk very passionately about quality control, and it is obviously a very important part of ensuring that we are sending out really top quality maggots to you. And I bet that's a phrase you never thought you'd say. So we are constantly checking throughout the entire process of creating the biobag, creating the larval therapy. Our quality department worked really hard with production to make sure that we are sending out batches of biobag that are to a standard. We're making sure the larvae are good colour, good size. We're looking at things that might affect the larvae and their ability to perform properly. And we will do sterility checks. They do take a while to come back. So as it says, their results take 14 days to come back, but we are constantly monitoring those checks. So even if we think something might be coming onto those plates, those swabs that we've taken that could show a positive outcome, then we will contact you. And hopefully you never hear from us to say that something has come back and could you keep an eye on your patient, but that's something that we have in place to make sure if there's any risk to the patient, we're contacting you and we're giving you advice on how to monitor your patients. Okay, and of course, once we've got the biobags all set up, we're then sending them out to you, and that is a big part of the production. We all hopefully know and love biobags. It's as said, it's a heat sealed mesh pouch. and it's important that you know that it's a very precise dosage. So we're not sort of guessing how many maggots we put in. There is a way of measuring and making sure that we have got exactly how many we told you would go in. And we're having to constantly meet the orders that come through to us. And so there is a little bit of a deal that we have to make with you guys in order to make sure that we're achieving those orders and getting them out to you in a timely manner. So we do need to have those orders by 2 p.m. on a Monday to Friday. And I hope you can see now, by seeing the production process, why that's so important. We are constantly making up these larvae bio bags, and we're not got them on the shelf ready to go. So, you know, when we say 2 p.m, it's not because we're being awkward, it's because we're making sure that we're sending out top quality product to you guys. When you get your prescriptions written up for your larvae, do make sure that you've got all the information ready so that you can get that order through to us in a quick manner, and make sure you're not having to keep going back and find out information. So we do need to know, obviously, the code of the bag, how many bags you want, when you want it delivered. We do need the GMC or PIN number of the prescriber, and that's so that we meet the standards that MHRA set for us. So we have to collect that information. So the more you can collect before you ring through to us or email through to us, the better, so that we can get to meet that 2 p.m. cutoff before it gets too late. And then, of course, don't forget that delivery is an important part of that as well. We aim to get the larvae to you the next day. We do rely on external couriers. We have couriers come and collect the larvae from our facility and bring them to you. And so, you know, traffic is a thing. Weather conditions sometimes can be a problem. If there is going to be a delay, though, we will let you know. But otherwise, you should get them about midday the next day. And then you'll have until midnight the following day to put them on your patient. And in case you didn't know, just keep them at room temperature in the packaging when you get them until you're ready to use them. And as with anything, if you get any questions, that's what we're here for. If you're worried about the if something's happened to the bag, if you're worried about the quality of the bag that you've been sent, then that's what we're here for. Give us a ring, have a chat with us, and we will see what we need to do to make sure that you're getting the best experience with larval therapy. So that is almost it from me. If you've got any questions, then do feel free to type them in the Q&A. Make sure that you're getting those questions through to us. We want to hear from you. We want to make sure you're happy, that you've understood what's going on when we're making maggots, larval biobags up, sorry. But hopefully that sort of made things a bit clearer, how, you know, there is a 7-step process to creating biobags. It's not just scooping them up and slinging them in a little bag. There's a whole process of disinfection, looking after the larvae, and of course looking after the flies to make sure that they are happy and healthy and producing healthy maggots for us. Whilst you're typing in your questions, I'm going to go through some case studies, because it wouldn't be a wound care webinar without some case studies, and hopefully they'll spark your interest, and maybe if you haven't used larvae in a while, you might see some patients similar to the ones that I'm going to show you now. So we're going to start with a hematoma. This was a 78-year-old lady who had, bless her, presented to A&E with this very large hematoma that you can see on her leg. Basically, she'd fallen up the stairs and skidded across her landing, which is how the hematoma resulted. She tried to manage it at home for a bit, but it didn't really get any better. So when she was in hospital, they offered her surgery, which she politely declined. So she went on to 2 weeks of bed rest and elevation. After that, they decided that maybe they'd try some larvae, but they were a bit worried about bleeding, so they didn't want to try the whole wound in one go. They just decided to put a bag on a small area at the base of the wound and see how that progressed. She had that one round, and not best photo, but you can see that it has started to progress, and they were more confident that actually they could put more larvae on the wound. So she had 2 more rounds, and you can see here, so in just what's that, 21 days, the wound has been fully debrided, and you can just about make out some granulation tissue as well. And I'll show you the before and after so you can really appreciate just how much difference there is. And I'm sure you guys are always seeing hematomas, and you know, I'm sure they're becoming more common as our patients get older and more frail. So maybe there's someone out there who's very similar to this, who larvae would be an ideal option for. And then next up, we have got a surgical wound. This is an 83-year-old gentleman who he had come in, had aortic valve replacement and coronary artery bypass graft ×3. This was the donor site for that procedure, and you can see it had dehisced. Wound, obviously, as you can see, very sloughy, and they confirmed Pseudomonas and MRSA positive. And originally, they decided to sharp debride and put topical negative pressure on, but after about 3 months, it's really not progressing. You can see that slough still there. There's no real signs of positive healing, so they decided to discontinue the negative pressure and put some larvae on. He had one round, I think it was our BB300, the long one, and you can see here looking vastly different. I'll show you side by side because you can really appreciate just how much better that looks, and I'll show you, you can see that actually now the putting negative pressure on will be able to function a lot better and really promote healing now, because you've really prepared that wound bed really well. And you can see just how much bigger the wound looks as well. And this isn't an uncommon thing with larvae. We do see this regularly where, you know, they can tell a lot better than we can just how much dead stuff there is. So they'll clean it up, and it you know, it does look a lot bigger, but we know that's going to heal a lot more effectively now. Okay, so I'm going to take your questions shortly. Whilst I'm answering questions, I'm going to leave this slide up, which just shows you our contact details. If you think of any questions after today, that do take a note of them. We'll take some questions, and I've got a few more bits to show you before I let you go. So any questions, Rebecca?
Fantastic. Thank you, Vicky. That was a brilliant presentation. Yes, we do have one question so far that's come through from Jen. She's asking, are there any nutrients or food available for the larvae in the biobag while they are in transit to a patient?
It's a good question. No, there isn't. So some people ask about the little white cube in the biobag and think that that's a food source. No, there isn't any food source in there. To be fair, they'll last pretty well for that sort of 36 hours before you put them on the wound, but that is why we have a use by date, because that's when they sort of start to perish. The little cube, which I was talking about, which some people do think is a food source, is simply to keep the bag open whilst the larvae are so tiny. The sides would stick together if it wasn't in there, and they wouldn't be able to move around. But no, they're fine. They're fine whilst they're travelling to you to get to survive until they're put on the wound and get that food source.
Wonderful, thanks, Vicky. So we don't have any more questions for the time being, but everybody, as Vicky said, do please get those questions to us this evening. You can do so if you just press the Q&A button at the bottom of your screen and type in your questions, and we'll see them and we'll answer them for you at the end then.
Cool. So just a couple more things before we answer questions and leave you in peace. I said at the beginning that we weren't talking about the clinical side of things today. If you do want to learn about that, there's a couple of ways you can do that. So our website has got our BioMonde now, which is all our videos, and it's actually all of our old webinars recorded, and they're on there as well. So if you want to watch any of them, you can. BioMonde Academy, which is our module-based learning. Really good if you're brand new to larvae, I have to say, because it covers a little bit of everything. It's a good foundation to get you started. And finally, we've got our BioMonde Direct. So that is where you can book a session with yours truly, from 15 minutes to 3 hours, depending on what you need and sort of your learning requirements. And you can see my diary and you can book a time that works best for you. So feel free to go on there and book a session with me if you want to learn some more. We also have our social media platforms. If you're obsessed with them like we are, then you know, do feel free to come and find us on your favourite one. Just type in BioMonde UK and you'll find us there. We're particularly active on LinkedIn, and also all the recordings we do of our webinars go on YouTube. So they're probably the two I would mainly recommend, but you know, we're on all of them. And we've got so many more webinars coming up this year. We've planned them all the way to November. These aren't all of them. We have some more which we'll announce as the months go on. But if you have found this interesting and you want to learn more, then go onto our website, click BioMonde Live, and it will show you the whole list of all of the different ones, and you can pick the ones you want to come and join and register as you did for today's. So do feel free to go and have a little browse, and also keep an eye out because we've got some special ones which we'll be announcing through the next couple of months as well. And the last thing I just wanted to talk about before I leave you in peace or answer any questions you might have is BioMonde's doing some good projects this year. We're working on a debridement pathway. So if you have problems in your trust where there's inconsistencies with what people use or when they use, then do get in touch with us, and we'll come and have a chat with you at the work we're doing. We're really excited about it. We've made some progress already with a few trusts who are interested in creating a pathway. So, you know, if that's something you'd be into, come and have a chat with us. We are looking to get some new case studies. So if you've used larvae, any situation, doesn't have to be a particularly weird or wonderful one, any situation, and you would like to share your story, we will absolutely help you create a case study. So please do get in touch again. We do all the hard work, you just get to take all the glory. So, you know, do feel free to get in contact. And we're coming to some conferences this year. So if you want to come and meet us in person, we'll be at Wound Care Today in Milton Keynes in March. We'll be at the Malvern Diabetic Foot Conference in May, and we will be coming to Harrogate for Wound UK in November when the date is announced. So lots coming up for BioMonde this year, and we would love to get you guys involved. So do get in touch with us if there's anything you would like to be a part of. Otherwise, that is absolutely it from me now, I promise. Are there any more questions?
No, there aren't any more questions, but
Okay.
everybody's given some lovely feedback, just saying thank you. They enjoyed.
you.
We've got colleagues from Germany on the call. Hello. And we've got some nursing students as well. So it's great to know everybody that you've enjoyed. Thank you very much for attending this evening. And Vicky said we do have lots more webinars coming up for you this year. So yeah, please do register for those. And if we don't see you on a webinar, then we do hope to see you at a conference very soon. Good evening, everybody.
See you later. Take care, guys.